The proportion of visits due to influenza is, for the last week, the most recent week, was 4.1% of all visits to this network of physicians. To give you some idea of the magnitude that represents, this is twice as high as the historic maximum that we see in a typical seasonal influenza season. We also track medical service plan billing claims for physicians, so the proportion of visits to doctors that are due to influenza. And in interior health, that proportion is above the historic maximum for this time of year, and it is approaching the historic peak that we see in any flu season. The same situation exists in all of the other health authorities except Northern Health, which is moving in that direction right now. We are also tracking the prescription of Tamiflu, the antiviral medication that is used to treat influenza infections. Interior Health has been seeing at least 4 weeks of increasing rates of prescriptions, and in the last week the prescription rate increased by 50%. And the steepest rise has been in the East Kootenay, which seems, of all the areas within Interior Health, to be the one most affected by circulating influenza right now. We, in the last week, have had 11 schools report absenteeism rates of more than 10%. And then the last thing that we track is hospitalizations, hospital admissions with lab-confirmed H1N1 infections. And in the last week, Interior Health had 6 admissions. We have had in total, since this virus first appeared in April, 20. So 30% of our admissions due to H1N1 have occurred in the last week. And that same pattern is being seen across the province. 30% of all identified admissions have taken place in the last week, or the week ending the October the 17th. The admission rates are actually highest in children less than 2 years of age, children between 2 and 9 years of age, and in the 20 to 39 year age group. Again, reflecting the pattern of this virus, which is that it targets younger people and young adults. And as we have seen with this virus right through the time that it has been circulating, about 60 to 70% of those admissions are in people with underlying medical conditions. The most prominent one being chronic lung disease or asthma, but others that contribute significant or frequently seen underlying conditions are immune suppression, pregnancy, and obesity is also one that's seen in about 4% of people that are admitted. So all the indicators are showing that we are in a rapidly rising wave of H1N1 activity.